I'm Jake from Thrive Proactive Health. So we're gonna walk through an exercise to loosen up tight shoulders. So I'm gonna show you her shoulder internal rotation measures before the exercise. I'm gonna have her do 5 sets of 5 breaths, and then we'll recheck and show the gains in range of motion. So on this side, we can kind of see. So ideally this hand is getting to the floor. So right now she's pretty restricted on her right side, and then coming around to her left side, also pretty restricted. So we're gonna loosen these up. So she's gonna take a bar, and from here, so she's gonna try to keep her knees relatively together. And from here, her goal is to get the bar over her feet by sliding it up her shins. She's gonna get as far as she can. You can bring your feet in. Okay, if you're able to get it over your feet, then you're trying to push it off your feet. Once she gets here, she's gonna inhale through her nose, exhale through her mouth, and go for 5 breaths. All right, so she just completed 5 sets of 5 breaths, so now we'll recheck. So we can see on her right shoulder, definitely a lot more close to the ground, still a little bit restricted, but certainly an improvement. On the other side, definitely better. So the reason that this works is based on the fact that both of her internal rotation measures were restricted. That indicates that she's in this flared ribcage pattern. So what this is doing is it's trying to bring these ribs down, get some air back in here, which is gonna help loosen up those shoulders. All right, so if you're ready to try this exercise to improve your shoulder range of motion, here are a couple things to keep in mind. So make sure as you're bringing your knees in to not let your knees creep out, right? So if you find yourself doing that, a simple remedy for that is just to add a ball between your knees, and that's gonna keep everything nice and stacked. Another thing, make sure that you have a nice and long exhale, so inhale through the nose, big and long exhale through the mouth.
Perfect.